You reach for a fever medicine. But which one? There are at least 4 different types sitting on pharmacy shelves, and they do not all work the same way. Some reduce inflammation. Some are gentler on the stomach. Some carry risks most people have never heard of. The difference between them is not just branding, it is biology. And knowing that difference might matter more than you think. Before we get into the medicines, it helps to understand what fever actually is. When your body detects an infection or threat, it releases chemical signals called prostaglandins. These signals travel to a region of the brain called the hypothalamus, your internal thermostat, and instruct it to raise your core temperature. That rise is not a malfunction. It is a defense. Many bacteria and viruses replicate less efficiently at higher temperatures, and a fever also activates your immune response. So fever is not the enemy. It is a signal. What fever medicines do is interrupt that signaling process, and each one does it slightly differently. The most widely used fever medicine in the world is paracetamol, known in the United States as acetaminophen. It works primarily in the brain and central nervous system, where it blocks the production of prostaglandins that tell the hypothalamus to raise temperature. The result is a lower fever and reduced pain perception, without directly targeting inflammation in the body's tissues. That distinction matters. Paracetamol is generally well tolerated, does not irritate the stomach lining, and can be used across most age groups when used correctly. However, it has one important vulnerability: the liver. Paracetamol is processed by liver enzymes, and when taken in excess or combined with alcohol, it can cause serious liver damage. The risk is not theoretical. Acetaminophen overdose is one of the leading causes of acute liver failure in several countries. The medicine is safe within recommended amounts. The danger comes from exceeding them, often unintentionally. Ibuprofen works through a different mechanism. It belongs to a class of medicines called NSAIDs, non-steroidal anti-inflammatory drugs, and it reduces fever by blocking enzymes called COX-1 and COX-2. These enzymes are responsible for producing prostaglandins, not just in the brain, but throughout the body. That broader action means ibuprofen can reduce fever, relieve pain, and also reduce inflammation at the source, in a sprained joint, a swollen tissue, or an irritated area. That makes it more versatile than paracetamol in certain situations. But that same mechanism brings trade-offs. Because COX-1 also plays a role in protecting the stomach lining, blocking it can lead to irritation, ulcers, or gastrointestinal bleeding in some people, especially with long-term or high-dose use. Ibuprofen can also affect kidney blood flow, which is a concern in people who are dehydrated or have underlying kidney conditions. Aspirin is one of the oldest medicines in modern use. Like ibuprofen, it inhibits COX enzymes and reduces prostaglandin production. It can lower fever and relieve mild to moderate pain. But aspirin also has an additional effect. It irreversibly inhibits a component of blood clotting, which is why low-dose aspirin is commonly used in heart disease management. For fever specifically, aspirin has become far less common than it once was. The primary reason involves a rare but serious condition called Reye syndrome, a condition affecting the brain and liver that has been associated with aspirin use in children and teenagers recovering from viral infections. Because of that risk, aspirin is generally not recommended for fever in younger populations. In adults, it remains an option, but it has largely been replaced by medicines with fewer complications for this specific use. Naproxen is another NSAID that works through the same COX-blocking pathway as ibuprofen, but with one key practical difference: it lasts longer. Where ibuprofen may act for 4 to 6 hours, naproxen can remain active for 8 to 12 hours, which means less frequent dosing. Other NSAIDs exist as well, including diclofenac and ketoprofen, and they share the same general mechanism. The trade-offs are also similar: potential for stomach irritation, kidney caution in vulnerable individuals, and reduced suitability in people on blood thinners. For fever, naproxen is less commonly used than ibuprofen or paracetamol, but it is a legitimate option in certain adult contexts, particularly when longer-lasting relief is needed. So, how do these medicines actually compare? Paracetamol targets fever and pain centrally, without touching inflammation, and is generally easiest on the stomach. Ibuprofen and the other NSAIDs reduce fever, pain, and inflammation, but carry more gastrointestinal and kidney considerations. Aspirin shares the NSAID mechanism, but adds a blood thinning effect, and carries specific restrictions for younger age groups. Duration of action also differs. Ibuprofen is shorter, naproxen is longer, paracetamol sits in the middle. Think of it like this. Paracetamol is a targeted signal blocker. NSAIDs are broader suppressors. Same destination, lower fever, but different routes through the body, with different passengers along for the ride. Fever medicine manages the symptom. It does not treat the underlying cause. In most cases of mild illness, that is perfectly sufficient. The body handles the infection, and the medicine makes the process more comfortable. But there are situations where a fever is signaling something that medicine alone cannot address. Severe dehydration, for example, can both worsen a fever and reduce the body's ability to respond to it. A fever that remains very high, continues for several days, or is accompanied by other serious symptoms may indicate a bacterial infection requiring targeted treatment. In young infants, even moderate fever can warrant prompt medical evaluation. Fever medicine buys time and comfort. It does not replace the need to assess what is driving the fever in the first place. There are a few principles that apply across all of these medicines. First, read the label every time, not just the first time. Dosing recommendations vary by age, weight, and formulation. Second, watch for duplicate ingredients. Many combination cold and flu products already contain paracetamol or ibuprofen. Taking them alongside a separate fever medicine can push total intake beyond safe limits without the person realizing it. Third, avoid prolonged use without reassessment. These medicines are intended for short-term symptom management, not extended unsupervised use. And fourth, underlying health conditions matter. Kidney disease, liver conditions, gastrointestinal history, pregnancy, and age all influence which medicines are most appropriate. Every fever medicine on that pharmacy shelf has a specific mechanism, a specific profile of benefits, and a specific set of considerations. Paracetamol is widely tolerated, but demands liver respect. Ibuprofen offers broader action, but requires awareness of the stomach and kidneys. Aspirin carries historical context and specific restrictions. Naproxen offers duration. None of them is universally best. The right choice depends on the person, their age, their health history, and what their body is dealing with. Fever is a signal worth listening to, not just suppressing. Understanding the tools available to manage it is the first step toward using them wisely.